On a microscopic level, they exist to kill. They travel, they attack, they hide, they even gather together in defense maneuvers. Pathogens are the enemies of every member of the healthcare team. On Pathogens and PPE, we give you the tools you need to fight these threats and win. So sit back, tune in, and let's make these microbes tremble at the sound of your name.
Welcome back to the Pathogens and PPE podcast. I'm Jill Holdsworth, Manager of Infection Prevention at Emory University Hospital, Midtown in Atlanta, Georgia. And this is the last official episode of this podcast series. This is number 12, all about the future of infection prevention and sterile processing. And I have in the studio with me today my friend and colleague, Rebecca Alvino, and she is going to introduce herself to all of you.
Thanks, Jill. Hi, everybody. My name is Rebecca Alvino. I am an infection preventionist. I was an OR nurse, and that suits me well in my current role as System Director of Sterile Processing at UCSF Health in San Francisco, California.
Awesome. And we have some really cool guests for you today. We have Deanna Hillstrom and Brandon Gantt, and we are going to share all sorts of ideas, thoughts, and wishes for the future in SPD and IP. So don't go anywhere. We will be right back. Here we are, everybody, with episode 12 of the Pathogens and PPE podcast. This is all about the future of infection prevention and sterile processing. And I have with me my co-host, Rebecca, and we have two awesome guests today, Deanna and Brandon. Brandon, why don't you go ahead and give us a little bit about yourself? I know you've been here before, but let's remind everybody who you are.
Hello, everybody. I am Brandon Gantt, the Manager of Education and Training for the Emory Healthcare SPD system, and I am also currently on the Board of Directors for the Healthcare Sterile Processing Association, so it's great to be here again today.
Awesome, and Deanna is back with us again as well. Deanna, remind everybody who you are.
Yeah, my name is Deanna Hillstrom, and I'm the Manager for Infection Prevention for Novant Health located in North Carolina.
Awesome. Well, this is going to be a great way to wrap up this podcast series. Again, this is the 12th episode of this series, so hopefully you guys have been able to listen to all of the other ones, and we are excited today to talk about the future of where we see sterile processing and IP going and what we wish for the future, where we think we should go, where we know we're going to go, and where we hope that all of you listening to this podcast series will help both of these professions go. So just to get started, let's talk about where we hope the relationship of sterile processing and IP moves as we look forward to the future. And I'll start with Brandon on this one. Where do you hope to see sterile processing and IP 5 years from now, or moving towards the 5-year mark? How do you see the future of our two roles moving more towards a better partnership?
If anything, I would love to see even more increased collaboration. I will say that since coming to Atlanta 3 years ago, just the amount of involvement from the IP team has been invaluable, and it's been phenomenal. And I just want to see that relationship continue to grow, whether it is IP people specifically coming to the sterile processing department to train, or sterile processing training in IP, and really working hand in hand to really build a relationship and strengthen things between those two areas, because I think sterile processing really cannot go far without infection prevention and vice versa. I think IP has their hands in so many things that we touch on slightly, but they bring a wealth of knowledge to us with our processes, some of our policies and guidelines. And I just want to see things blossom even more.
So I agree, Brandon. The relationship between infection prevention and sterile processing has come a long way from where it once was. And you're absolutely right. To see that partnership continue to grow, especially as healthcare changes especially as healthcare delivery changes. I think it's really important to ensure that sterile processing can lean on infection prevention as these delivery systems grow in order to help reinforce the needs that sterile processing is expected to meet.
Deanna, what about you? What are your thoughts for the future?
Yeah, no, I would say I think where we're at now is definitely a good start. I mean, I can speak from my experience this week. One of the tech's birthdays in sterile processing was this week, and actually pulled regulatory in. We went and brought a little birthday present to them, and I got an email from a manager in sterile processing this week about a webinar, and I just think the collaboration already is already so key, and I think it's just going forward in the future to be able to make, like I talked about on the last time I was here, being able to make it more personal, because the more personal you are, the more eager they're going to be to pick up that phone and call you to say, hey, I messed up on this, or I need help on this. And I think just being able to work more on a level like that, I think that's definitely a future of infection prevention and sterile processing.
Yeah, I couldn't agree more. And on one of our past episodes, we talked about really making sure that we're working on the same level. Like you talk about making it more personal, being able to walk into either one of our offices, whether sterile processing walks into my office or I walk into their office and say, I need help. I need you to show me how to do this. And to really let each other know that we're working together. Neither one of us is above the other. And we're really here to work on the same team. We're part of each other's team. And I think that's really important. And we're kind of inching towards that type of relationship more across the country, but I think that we still have a long way to go. But we have some great examples of teams that are working that way, and I think this is just paving the way towards a lot of change and a lot of impact. So I think that's fantastic. Okay, so let's move into some deeper subjects. So let's talk about advances in PPE. And this is one of my favorite topics, but let's start with Deanna on this one. If you could improve something about the PPE worn in sterile processing, or if you could think of one way that we could make it easier for our sterile processing colleagues with in regards to PPE, what would your number one thing be?
Well, that's a great question. And this comes up frequently because when they're spending, especially in the decon area, they're spending all of that time and they're sweating after having to process 16 trays for one case. I think something that obviously we want to make sure they're following for their safety, but making it so it's more breathable and more that they're more eager to wear it, to understand that they're protecting themselves, but understanding the implications it does have on them wearing it for 8 hours straight when they're in there. I think just the comfort for them.
Yeah, I remember right before the pandemic, fortunately and unfortunately, when I was an infection preventionist, one of the things I had thought about walking through one of my decon areas as an IP would contained air purifying respirators or cappers, sort of that bicycle helmet looking device that you can wear in lieu of an N95 respirator. Would that bring comfort and adequate respiratory protection to the folks doing that decontamination work? Of course, I had that thought, I think maybe in January of 2020. What happened in February of 2020? Those cappers were very quickly and rightfully redistributed to the frontline clinicians. But that is one improvement I've thought of. Is there anything else like that, Deanna, that you could think of? Because that's definitely a pain point in the decontamination areas.
Yeah, no, that's a great question. I don't know if I've ever thought about having that in there, but I think if there's options like that, I definitely think that's a great approach to be able to still be able to protect them so they're not having to have that ASTM rated 3 or 4 on their face, but being able to talk and everything. I've also thought, like, if you had some kind of apparatus like that, if you could have, because it's so loud in there and, they're spending hours in there by themselves, or you might have somebody else in that space. If they had that, like thinking about a motorcycle helmet, is there a way to communicate if you had headphones in there so they could talk to each other while they're going through the day?
Yeah, I think this is such a great discussion because I know that some people have tried using a PAPR or a capper system in sterile processing, and it's kind of adapting something that wasn't meant for sterile processing to be used in sterile processing. Those were meant for going into, airborne isolation rooms, not so much for a space that has a high droplet dispersal, an area where you might have a lot of droplets flying around, and you need more of a fluid resistant type of apparatus. So I think this is an area where if there's somebody listening that is interested in developing something that is like a capper system but is more fluid resistant, then I think there's definitely a market for that. And for those of us that have worn the old PAPR systems and then went to something that is more like the capper system, it is nice to be able to hear and to have your ears uncovered, but those systems are not easy to talk with no matter what. So I think there's definitely improvements that are still able to be made, but I love the idea of comfort. I think that there is still definitely room for improvement with the chin up PPE for sure.
Yeah, I think my desires for PPE probably echo Rebecca as well. Just lighter PPE. People are in decontamination. They're completely gowned up. They have gloves on, heavy gloves. They're sweating. They're working in a hot area. And I was just looking at some of the advancements in PPE where people are really talking about even using like nanofibers now, which are really good at blocking out pathogens and everything, but are lightweight for the worker, which would be such a bonus for the people that have to spend hours wearing them. Because, I don't think anybody realized how vital PPE was until COVID-19 came around and people started passing out trash bags to use as PPE, which was a no-no for the staff. But also thinking about reusable PPE as well to cut down on the amount of product that is actually going to landfills. Because you think about sterile processing, we output a lot of waste that is going to our landfills, and like how can we make that better, and what aspects of our PPE could be reusable so that way we did not have to discard so many things. So, I think there's definite rooms for improvement when it comes to looking at like reusables and recyclables and just overall making things a little bit more comfortable.
I love that you mentioned the reusable gowns. I think that is one area that would be a little bit easier to look at for the sustainable healthcare type of movement. And there's some areas that aren't as easy to look into, but the reusable gowns, it obviously has a lot of regulations and processes built in as well. But if you could have a reusable gown that meets the AAMI standards for sterile processing, then I think that's a really great option, especially if it is also comfortable and it might breathe easier. And so I'm glad that you mentioned that. I think that's a really great thing that people should start looking into and seeing if that's a better option, and maybe even just trial it and see if it's an option for your team members. And even if it's not, even if you go through a couple different trials, at least your team members will see that, hey, they care about our comfort. They're trying new things. They're listening to us. And that's important just in itself. I'm going to switch gears here about another kind of future look. Talking about disinfection methods, we have all sorts of different things right now. And if we look 5 to 10 years down the road, what do you see changing from the methods that we use now? And Brandon, I'm going to ask you to tackle this one first. Do you see us changing our current processes? Do you see IFUs changing? And I'd like to hear your thoughts on what you see changing and also what you hope to see change.
With the disinfection process, I think like there are probably a lot of new disinfectants on the market, things that are safer to use, maybe things based around hydrogen peroxide disinfectants or even electrolyzed water. And I think that may be a way for the future when we think about the harsh chemicals that are really being used, that are going into our water supplies, and that people are really dealing with on a day-to-day basis. And I think that certainly, as far as the EPA is concerned, it certainly is something that they should really like look into and investigate more. I think there's more development that needs to be done around those things as well. And also maybe even light activated disinfection too, when we think about the areas that we use our work surfaces, clean it up in our decontamination areas, as again, as a way to move away from some of the harsh chemicals that we are using right now. So I think there's definite room for growth. I don't know how far away we are from those spaces yet, but my hope for the future is right.
Brendan, I think you raise a really good point there about light activated technologies. Immediately my mind goes to no touch technologies that are continuously activated, that are going to be able to reduce contamination levels within an environment without necessarily disrupting people that are working there, right? And we've already seen no touch technologies that have come to market: UV, vaporized hydrogen peroxide, electrostatic fogging. What have your thoughts been, or your experiences? Or I see that really as being a direction that a lot of healthcare facilities want to head into, not just because of the risks that they will reduce the users from in terms of touching, going into these spaces, but also because it reduces the amount of time you actually have to put a person to applying that technology, that you'll be able to disinfect a space while utilizing that person someplace else.
Mm-hmm. During the pandemic, at an organization I worked at, actually at the Penn State Health, Milton S. Hershey Medical Center, we started using ultraviolet light devices for the first time to clean some of our work areas, some of the ORs, and then also the cafeteria area. And I was really taken by that, just the technology that was available. The one thing that concerned me was, how do we know this area is clean? Because it was such a new technology for us. We'd press the start button and then move on. And so if anything, I think that's the only thing that would be in my mind about using technologies like that. How do we go back and verify that that area is indeed clean? What is the verification with things like that?
And that's a really great point, Brandon, and it's a really cool one to bring up because IPs are really used to using UV technology for surface disinfection, and I won't spend too much time on this, but you can also reference Amy's ST79 in the Amendment 1 on environmental services, because it gives you some tips on how to do this. So if you are using UV light technology, the number one thing you have to remember is you must clean the surfaces first. You can't just stick a UV light in a dirty room and expect everything to be zapped free like something in outer space. And I think that that's one misconception that people think. So it does have to be cleaned first. So UV light is more of a secondary disinfection method. I always tell people it's the double check. To verify that things like that work, you can do all sorts of different things. And this is something, again, that IPs are used to, but I don't think we're as used to doing this kind of surface monitoring in sterile processing, but it's somewhere that I think a lot of people are starting to go because we are doing it in a lot of procedural areas. We can use ATP testing. We can use bioluminescence monitoring for surfaces. And some of those are listed in the ST79 Amendment 1 as some tips for doing those kinds of verification testing. So anybody that's listening that needs some suggestions on how to verify that you are abiding by this Amendment 1 that came out with ST79, then check out the amendment verbiage. But great discussion. I love talking about environmental services and all the different ways to clean. All right, Deanna, you've gotten to listen to a lot of this. What are your thoughts?
I mean, I echo a lot of what you guys have been saying. I think the complexity of all of it, and I would love to see some of that change, because I know all of you have spent some time reading IFUs and looking at all the different things, and it is overwhelming for team members or even IP or anybody else to be looking at. And then also, you have how many different pieces of equipment or instruments within your facilities. And of course, they all vary a little bit. So having it, is there a way to make it so more of them are compatible with the same things? And so that way it's not a team member. Obviously, we still need to read the MIFUs, but instead of having 45 different products, could we narrow it down? So I think that's one big source of tension and within healthcare facilities now is having to figure out, okay, which products are the most, but I have to have these products in the facility to make sure that I can cover each one. And So I'd love to see some streamlining of that.
That's a really great point, Deanna, because I know even within my own experience, and I think many of us can commiserate here, one of the major challenges we face in healthcare facilities is all of the different pieces of equipment that are validated only for very specific products, and who is responsible for ensuring whether the product we're trying to streamline to is in fact validated for this very specialized widget that's important to patient care, but you just don't have the product within your facility. That, in my wish, would be, can we get these products validated across all of these different important pieces of medical equipment that are imperative to patient care? But I think also one of the things that I would be interested to learn more about is, do you have a process in place within your facilities to vet some of these purchases before they happen to see, is this something that can be supported? And if not, what is it going to take to support it?
Yeah, I think that in the past it hasn't always been a great process, and so we've had to do a lot of behind-the-scenes work where all the infection preventionists within the system, had to pull that list of equipment and pull the IFUs, what's compatible. But I think we've started heading in the right direction where there's a work group that comes together and is starting to vet some of the products before they are purchased, so we can look at some of those, because if there's things that maybe do we have the right equipment to set it up? Do we have the right areas to be able to put something for reprocessing in? It's not always as simple as let's just buy it and put it into an area. Is it the right pressures? Is it all of that? So I think having the work group that we have now is definitely going to help streamline and make it so we're successful from the very beginning.
Rebecca, I think that is my wish for the future, that every scope, every piece of equipment, every instrument that's purchased that's new and we haven't had before goes through an interdisciplinary team that has an IP on it. And I know that's a big ask, but I can't tell you how many times there's been a new scope that comes in and they bring it in, and then all of a sudden the physician panics because it's really, really difficult to clean and they don't know how they're going to do it. And once we look at it, we're all thinking, I would never have purchased this one. So it would be great if we all work together prior to making these kind of poor decisions, or we make a plan ahead of time, because sometimes you just need to plan on a lot of extra time to make things work correctly, or it's going to take an extra hour to do this correctly, and make sure everybody knows that if you buy this one, this is what's going to have to happen to make sure that it's safe for our patients, so that everybody's aware, and then let them make the most informed decision. But once it's in your facility, there's nothing more you can do about it. And then everybody gets mad when the IP comes in and says, well, this is what has to happen in order to make things safe. And then that's when we become the bad guy. So that is kind of the hard part, because we're not always the bad guy. We're just telling you what has to be done to make it safe.
No, I completely agree. And Brandon, I'm sure you can probably feel this pain as well in sterile processing. I'm a strong proponent for having a sterile processing professional or leader at that table as well, to say, hey, yes, we can support it. We don't have the capacity, or no, we can't support this at this time.
And it's funny, over the last few years, I can honestly remember 10 years ago, I was working at a community hospital in Baltimore. And before any purchases were made, instrument purchases were made, they would contact the sterile processing department first. I have not seen that since. So if I could go back 10 years in time to that perfect place, that would be wonderful, because I think everything you've all said is absolutely correct. Let's actually look at, can we do this? Should we purchase this, and go from there? Because Jill, who I call my partner in clean, is absolutely right. Let's talk about this before we make the mistake first.
And we're supposed to be looking to the future, Brandon. We're not supposed to be
I know.
looking backwards.
Take me backwards.
That's terrible. But you're absolutely right. There is no one that should be purchasing anything that has to be reprocessed by sterile processing without consulting sterile processing first. And I feel like we've got this completely backwards and all wrong in our facilities today. And I don't know how to fix it, but hopefully bringing awareness to it will help fix it at least a little bit. All right, I want to move on to our last topic here. And I actually want to start with Rebecca on this one because I know we've talked about this several times, but I want to talk about the role of sterile processing when it comes to emerging infectious diseases. And I just want to hear some opening comments from Rebecca about how does sterile processing fit in when you have these special pathogens and emergency management in general?
It's, as you and I have talked about, right at the beginning of the COVID pandemic, especially, there was a lot of panic about what to do with these things that arrive. We were fortunate to learn very quickly about the type of virus that COVID is, SARS-CoV-2. It's a coronavirus. It makes it fairly susceptible to a lot of our usual processes, but there's still that panic, that fear that was generated from the pandemic that put people in a really uncomfortable position of handling these things. And when we think about like the hierarchy of controls, PPE is the last thing, but it's also the thing that's closest to us that makes us feel the most secure about whatever it is that we're doing, whether we're decontaminating instruments, whether we're working with our peers within a space that's somewhat confined. And as we move forward into the future and we think about not just emerging pathogens, but even the pathogens that have been sort of squelched that are reemerging, how do we make sure that our sterile processing partners feel safe, that we make sure that our sterile processing partners have been thought about proactively, not reactively, in those emergency response plans? Bioterrorism events, they're not something we hear about, but there's something we have to keep in the back of our mind. Q fever, smallpox, tularemia, anthrax, those are all things that are still very real threats, and we can't ignore the sterile processing realm when we're thinking about those emergency response plans, the PPE, how we're going to do surgeries. If we're doing surgeries, how are we reprocessing these things? It has to be within the forefront of our emergency response plans.
Yep, couldn't agree more. Deanna, do you want to comment on that next?
Yeah, no, I definitely agree with the keeping them at the forefront because, we're pushing this PPE all the time. And just because it's a pandemic or something else is emerging does not mean we need to go away from them wearing PPE because maybe it's not, in their minds, a bigger risk than COVID or whatever that emerging pathogen is. But I think on the other part is how can we partner with sterile processing? Because as much as I cringe when I say this, is, we reprocess N95s and whatever else. What are the other things that they could help? They're experts at what they do. What are the other things we might be able to reprocess? Are there things in that crunch time? So I think really pulling them in to be a partner on that and helping stay ahead of it. So that way you're, like you said, you're not scrambling last minute, try to come up with a plan, but start to think about in preparation so we don't get in a situation where we might have been in beginning of 2020.
Yeah, absolutely. And Brandon, I want to hear your thoughts. I know we've talked about a little bit about this in other instances, but what are your thoughts on including sterile processing in a broader sense in disaster management, emergency preparedness in general?
I think we really have to accept that another emergency can happen. Another pandemic is probably coming. It will happen, and we need to act accordingly. We need to kind of have those conversations now. I think in 2024, we're so excited to be away from 2020 that we are kind of saying, well, that's all in the past. But again, much like this conversation, it's also in our future as well. And how do we prepare for that? Because as sterile processing technicians, we will still be tasked with breaking that chain of infection, whatever it is. And we'll still have to clean and decontaminate and disinfect and sterilize and operate as we ordinarily would. But how do we do that in a pandemic-like situation again? And how do we prepare ourselves? Because I know, even at my previous hospital when we had our emergency reserve, nobody had checked on it for years and most of the things had expired. And so we don't want to run into those issues again. And so these are conversations that we need to have now where we need to partner with IP. And we need to talk about what does the future look like when it comes to emergencies and how sterile processing tackles those emergencies and dealing with everyday things that we need, because we need PPE, nurses need masks and so forth. And, I just think we have to be unafraid and we have to move forward with that conversation, because we are going to be in a dangerous situation again, unfortunately.
Great way to close out this session, Brandon, talking about looking towards the future. I think you're absolutely right. And with that, we are out of time for this session and this podcast series. Thank you all for joining us for the Pathogens and PPE podcast series. Stay tuned for episode 13, which will be next. And it is all about career progression and the AIPC. It is a bonus episode, so stay tuned for that for the next time. And with that, we are out. Thank you.
All right. Thanks, everyone. So, Brandon, Deanna, we heard about the future of sterile processing and the partnership of infection prevention being so important. We've talked about the role of sterile processing and how they've got to be in the forefront of our emergency response plans. Never let a good crisis go to waste. What is the future of disinfection in healthcare? Thanks so much for sharing with us today.
We also talked about some of the advances in cleaning surfaces and environmental disinfection, using UV light, and also using verification methods. We also talked about our wishes for the future in terms of PPE comfort and lighter PPE, more comfortable PPE, and how we want to explore reusable gowns and more reusable types of PPE. And really that our hope for the future is even more collaboration with each other and even more shared education with each other as we move towards the next 5 to 10 years. We still have a lot of work to do, but we've come a really long way. Thanks for joining us. Don't forget to wash your hands and keep fighting dirty.
Thanks for tuning in to this exclusive podcast series on pathogens and PPE. For more information and clinical resources to help you fight dirty, make sure to follow us on social media by searching for Beyond Clean and Transmission Control.